Okay, Ryan, I'm just going to take a look at your abdomen and just do some inspection. So first I'm just looking at the contour of your abdomen, see its shape, check for any bulges or masses, which I don't see any. Looks flat and soft. Inspecting the umbilicus for any discoloration. Just check to see that it's inverted, which it is. Position is midline on the abdomen. Good. Just checking the skin in general, which has the same coloration as the rest of your body. No discoloration that I can see. Checking for skin turgor, just pinch a little bit. Sorry if you're ticklish. Good skin turgor. Again, checking for any moles or lesions, any scarring that might indicate surgeries, which I don't see any present. Just a couple freckles. Then checking to see if I can see pulsations in his abdomen, which I can see the movement with respirations. Ryan, could you hold your breath for a second, please? I can go ahead and breathe again. I can see a little pulsation where the aorta would be. Checking hair pattern, which looks as expected for Ryan. Distribution also as expected, and the patient appears well nourished and well hydrated. I don't see any signs of distress. So now I'm going to take a listen with stethoscope for his bowel sounds. Starting in the right lower quadrant. Just relax. Good. Okay, so we have active bowel sounds in all four quadrants. And then the next thing I will do, I'll actually listen one more time to see if I can hear the aorta or the renal arteries. If you could take another, hold your breath for just a second. Okay, you can breathe. When you're ready, I'll have you hold your breath again. Okay, go ahead and breathe normally. One more time. Okay, go ahead and breathe. So don't hear the aorta or the renal arteries. Now I'm going to palpate a little bit. Just try to relax. If you're feeling ticklish, I'll take a break. So I'm going to palpate in each of the four quadrants, checking to see if anything is, see if we're soft, if there's any muscle rigidity, or if I can feel any of the organs, if they're enlarged, or if there's any tenderness. So, just sorry. Try to think about something else. Sorry. Take a break for a second. Just try to breathe. Good. We'll leave it at that. Okay. while I have you laying here, we're going to start doing some musculoskeletal assessment. So I'm going to start with a little bit of range of motion while you're seated. So first, we'll check your range of motion with your feet. If you can point your toes down, and you don't have a lot of space, and pull your toes back up towards your face. Okay, good. Let's see, I'm just going to assess, sorry, I'm going to take your socks off so I can look at your feet. Check for alignment and symmetry. See if there's any discoloration or bulges or masses. Check the skin as well while I'm here. Good. Let's see. So just have you wiggle your toes, bend them right down, and try to extend them out. Good. Let's see. And then with your knees, while you're here, I'll just check your knees for symmetry and see if there's any swelling or bulges, which it doesn't appear that there are. Maybe some bumps and bruises. No swelling though. Good. Let's see. So I'm going to have you sit up for a little bit. Jump around here a little for the sake of your positioning. So starting with your face, musculoskeletal, I'll have you kind of open your mouth, open your jaw, check your TMJ. Good. Kind of like shift your jaw, lower jaw back and forth. Good. Any pain when you do that?
No.
No. Open nice and wide again. Clicking or anything like that. Let's see. So I'm going to have you go ahead and stand up for me for a second. I'm going to assess your spine. So checking for, you can stand sideways. I'm going to just check for curvature, which looks appropriate. Go ahead and turn and face that wall. Checking for the spinal processes and their alignment, which appears to be straight. While you're here, checking your scapula for symmetry and positioning, your hips, your iliac crest, which are symmetrical, nothing appears to be misaligned, and then your shoulders as well. Good, also aligned. Now looking a little more at the shoulders for their, go ahead and face me. Checking for them being rounded, their bony prominences are symmetrical. Looks good. So I don't see any like spasming or muscle atrophy or anything like that. Do a little bit of range of motion all around. So starting at the top with your head, lean your chin as far forward as you can. Lean it back. Try to lean your ear over to your shoulder and the other way. Good. And then bend over and touch your toes as best you can. Checking for curvature there. Good. Go ahead and stand up. Then we'll do some range of motion with the shoulders. So have you raise your arms up over your head like this. And then put your arms down. Up, forward like this. Good. Touch your shoulder blades. Good. And then up the other way. Good. And then up like this. Good. Okay. Good. Thank you. I'm going to assess your elbows now. You stay there. And again, checking for prominences being equal, any masses or bulging, skin discoloration. Everything looks good there. No deformities. No tenderness or swelling. Have you do some range of motion here, bending your arms up to your shoulders. Good. Down again. Can you turn your hands? Good. Good. And now with your hands up, I'm going to assess your hands. Everything. Fingers look aligned. We do have one knuckle that is a little bit more swollen than the rest. Looks like maybe a past injury. Can you spread your fingers out for me? Good. Can you bend your fingers down? Good. Straighten them out nice and good. Bend your wrist down. Wrists look nice and aligned. No swelling. Good. Skin looks good as well. And then just looking at hips, you've got shorts on, but like I said, the hips look aligned from the front and from the back. I think we have good range of motion, likely. Can you kind of like twist your hip across your body? We would do this lying down, but we don't have a good space for it. And the other leg, do the same. Good. Okay. Can you swing your foot across your body like that? Good. And the other one. Good. Okay. I think that looks good. Go ahead and have a seat again. Okay, now we're going to check your neurological function. First, I'm going to check some strengths in both of your legs. I'm going to hold on here. Have you raise your left leg up off the bed? Good. And your right leg? Good. And now do them both again without me holding you down. Good. Good. Okay. Now again, we're going to have you bring your toes up towards your face. Good. Push down on my hands. Good. Okay. Let's see. And then I'm going to have you sit up on the side of the bed. Check your strength in your hands and your arms. So have you squeeze my hands. Give them a nice tight squeeze. Good. Have you pull your arms toward you and push away. Good. Okay, so first I'm going to have you take your right foot and drag your big toe from your shin up to your knee. Good, perfect. And then you can do it on the other side with your left foot. Good, perfect. Okay, and then I'll have you come sit on the side of the bed. And so you're going to tap your quads with your palms of your hands, and then flip and tap with the backs of your hands, and do that again, and do it a little faster. Good, perfect. Okay, now have you stand up, and we're going to do some walking. So just assess your gait. Go ahead and walk this way. Good, perfect. Now going the other way, do heel to toe walking. Good, checking for balance. Good, okay, and then take a couple steps on your toes, just a couple. Okay, good. And then also, again, on your heels. Good, perfect. Okay, and then going to have you stand with your feet very close together. And then I'm going to have you close your eyes. And I'm just checking to see for 20 seconds if you can stay nice and still. That's good. Okay, now I'm going to check a couple of other neurological things. So first I'll have you close your eyes. I'm going to touch you in different places with a cotton ball, so just tell me when you can feel it, okay?
Yeah. 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 Yes.
When you have your eyes closed, I'm going to poke you with different ends of a Q-tip. Tell me if it's a sharp feeling or a dull feeling when I do it, okay?
Dull. Sharp. Sharp. Dull. Sharp.
Okay, so I'm going to do your patellar reflex. Check for any quadricep movement. 1, 2. Good. Check this side. 1, 2. Good. Okay. Now raise your left hand up, but won't use your right hand. I'm going to have you close your eyes. I'm going to hold on to your middle finger, and I'm going to raise or lower your finger. So just tell me which direction it's going in.
Raise. Lower. Lower.
Okay, good. And I'll have you go back to the bed. I'm just going to check for your Babinski reflex to see if it is negative. Scoot up just a touch. Thank you. Okay. Good. Okay.